So Ambroxol is an over-the-counter cough medication that's available across almost the entire world, but not in Canada or the United States. It has a long safety record, including safety in high dose in pregnant women in Europe. It came to attention at the Hospital for Sick Children in Toronto in something called a high throughput screen where people were looking for drugs. And in this case, they were looking for drugs that stabilized an enzyme for Gaucher disease. So Gaucher disease is a disease where you are missing a key enzyme in a compartment called the lysosome, which is a normal recycling digestive part of the cell. And the substrate builds up and kills the cell. So it's a terrible degenerative disease in a multi-system, often including brain. So if you have two mutations in this enzyme GBA1 or glucocerebrosidase, then you have Gaucher disease, again, this horrible pediatric disease. But if you're a carrier, it turns out that this is the highest or the largest risk factor for synucleinopathies, so Parkinson's disease, dementia, and Lewy body dementia. And so this actually was found when I was a postdoc at Sick Kids, quite a while ago. So again, being an adult neurologist, I said, oh my gosh, we have to try this in Parkinson's disease. So this drug, at the time we started this, really there wasn't a lot of evidence, but a small number of patients with Gaucher disease had been treated and a small cohort in Japan. Right now, again, so that the cohort in Japan is published, and so there was actually improvement in cognition, in seizure frequency in Gaucher disease patients. And there are now probably 180 patients in basically case reports who seem to be doing better on Ambroxol, and this is widely used off-label. While our trial was ongoing, Dr. Shapira in England looked at 18 patients with Parkinson's disease, some with GBA mutations and some without, and found that there probably was an improvement in motor function in these patients. But so it's an open label study, so it was very encouraging, but it wasn't conclusive.